This is the Healthy Bones service based at Derriford Hospital in Plymouth. We provide bone density scans for patients referred by their GP or hospital consultant. The department has been doing these scans since 1995, originally for osteoporosis research, and thanks to a grant from the National Osteoporosis Society in 2008, we've been able to improve the services we offer our patients. The grant also allowed us to set up our mobile scanning unit, bringing the Healthy Bones service to the doorsteps of our rural communities. Having a bone density scan means we can assess whether an individual is at risk of osteoporosis and breaking a bone. In the UK, 1 in 2 women and 1 in 5 men over the age of 50 will break a bone mainly due to osteoporosis. So this service is vital in the fight against future fractures. Patients coming to Derriford receive their appointments within 2 weeks of seeing their GP. The scan itself is straightforward and only takes 10 minutes. There's no tunnel and it's completely painless.
The scan works by the use of X-rays and a computer. The computer then generates how dense a patient's bones are. From that data we are then able to calculate if a patient has osteoporosis or whether they're likely to get osteoporosis in the future. From that we are able then to compare previous data with current data to determine how effective treatment is.
And can I see the hands pointing outwards, not upwards?
Mary was diagnosed with osteoporosis after a bone density scan here at Derriford.
Yep, that's it, okay.
I was originally wondering about osteoporosis because my friend had it and I also saw how bent my mother's spine was. So I asked my GP what it was and whether I'm likely to get it. And he asked me questions, discovered that I'd had a very early menopause in my 30s, which meant I was lacking in estrogen, and he therefore referred me for the scan in 1999, and I was diagnosed with osteoporosis.
The results of all the scans we do are back with your GP within 2 weeks, and doctors based at the hospital can see the results on Derriford's secure computer system on the day of the scan.
Well, patients usually do not have any symptoms until they fall down and break their hip or wrist or vertebrae. The clues are that we doctors, hospital doctors and GPs are trained to find out who are at risk and send them for bone density scan and have the bone scanned. Those who are at risk are those who smoke excessively or drink excessively or have got certain medical condition which cause low mobility.
As well as a scanner based at our Healthy Bones service in Derriford Hospital, we have a mobile scanning unit that travels to the more remote areas of Devon and Cornwall. This allows our more rural patients to be scanned at their own GP surgery, cutting down on the cars needing to travel to Derriford Hospital and making our own small contribution to the environment.
Yeah. Was that early?
The scanner is identical to the one at Derriford, and patients can expect the same high level of care and experience wherever they are scanned.
It's very convenient coming here. I had to come here for a scan because I've been on steroids for a long time. And it's so convenient to come to my local doctor's surgery rather than having to drive to Derriford Hospital with parking, and so it's been very good.
We're absolutely delighted to have the mobile units here in the car park, raising the profile of osteoporosis scanning to give ladies an opportunity to take on board how important it is to have DEXA scanning. Interesting to look at the fact that a lady in her lifetime is more likely to be affected by osteoporosis than she is with breast cancer.
The Healthy Bones service at Derriford has grown over the years, and with the support of the National Osteoporosis Society, we now have the resources, skills and experience available to us to develop a more holistic and patient-centred service. We're always looking at ways to make our scans more accessible and informative for all our patients and doctors. And in the future, we hope to help many more people get back to their active lifestyles without the threat of broken bones cramping their style.
Okay, Mary, nice and still there. Machine's going over the top of you now.
Okay.
The National Osteoporosis Society is on hand to provide information and support for anyone who has questions or worries about all aspects of bone health, osteoporosis and fractures. The charity provides a helpline with osteoporosis nurses who have specialist knowledge and can answer queries either via telephone, email, letter, and we also have a discussion forum on our website. The charity has a comprehensive range of leaflets and booklets on bone health, fragility fractures and osteoporosis.
Two, one, two, run. That's great. And back and together and around. Don't have your hands too high.
I've never let osteoporosis cramp my style.